Welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare we provide to you at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units. Each November, the Army highlights the resilience and strength of soldiers and their families during Warrior Care Month. Master Sergeant Retired Cedric King is the recipient of the Bronze Star, the Purple Heart, the Meritorious Service Medal, and is a four-time Best Ranger competition participant. He shares his inspirational story and motivates others to see the possibilities in their own lives.
We were put in this tough place in Afghanistan in the summer of 2012. It's called Kandahar. We had to go and find the place where this enemy cell was fighting out of. We go out and we conduct a reconnaissance. And during the reconnaissance, we got into a shootout. During the shootout, I stepped on an IED.
I received a phone call at our old home in North Carolina letting me know that Cedric had stepped on an IED and that he had immediately lost his left leg just below the ankle and that his right leg was severely damaged. They wouldn't tell me if he was going to survive. The first 2 days, it was one more thing that had happened or one more thing that was wrong. They called and let me know that they had to take his right leg. They told me that he lost his middle ring finger. I mean, it was just bad news, bad news, bad news, bad news. Knowing how much pain he was in, knowing how much pain he's still in every single day, how many surgeries he's had, and that he still looks at life as a gift, that he still finds joy every day, that's inspirational.
It's actually a blessing. It really is. And I think it's our job to find out how it is a blessing, not how it is a curse, or not how it is a burden. It's how it is a blessing. I think you have to put challenges in your life that are so big that you don't think you can accomplish them, but you want to accomplish them. You set a goal that's bigger than what you think you're capable of doing. And you have to have enough courage to do that. When I got injured, I knew I wanted to not just walk again. I wanted to do the unthinkable kind of things. I wanted to run marathons. I didn't want to just get in the water and do water exercises. I wanted to swim miles. I think just because you take my legs away, you don't take away the competitor. You got to train when nobody's there. You have to be on the treadmill when nobody's watching. And that's how it's going to be most of the time. Nobody's going to be there while you're doing the training. This is the home of my gym. And this is where I come and work out when I can't make it to the gym down the street. I get my workouts here. And I got my inspiration up on the wall. These are 4 of the maybe 8 marathons or 7 marathons that I've done. But these 4, every last one of them was 26.2 miles. It's always requiring that you push to the limit. There are no moments off in one of these marathons. You have to put forth effort the entire time. But by doing that, you become a better you. And just like a marathon, life is no different. You have to have a moment in your life where you won, where you overcame something, where you didn't know if you could win, but you fought anyway. I knew I wanted to be a speaker. I knew I wanted to be a speaker from before I got injured.
The handicap is staying in that pain and letting that pain dictate the outcome of what will happen.
4.5 years ago, I'm dreaming about what I do today, helping people live their dreams, inspiring people to do what it is that they've always wanted to do. And today, that's what I'm sitting here doing.
He doesn't see his limitations. He doesn't put that label on himself as far as being disabled. He calls himself differently abled. And that's how he pushes through life. I am in a different physical package than you are, but there's nothing you can do that I can't do. And if there is, we'll find out after I try. think it's brought our family closer together because we know we can get through anything. We just have to be persistent. The family is one thing we weren't willing to give up on.
You still owe these kids, you still owe this woman. She does not stop needing me to be a good husband just because I got hurt. Kids, they still want you to be dad.
I love you again.
Oh man, this is tough.
I love you, girls. Love you.
Love you too.
This was the day he left.
Did you find
Look how
anything?
little they were.
Tell Daddy, say I love you.
Love you.
I love you.
Yeah, that was hard.
That was tough. That was a tough day. Man, that was a tough day. That's the day I left
Before getting
injured.
But as tough as things were, we still found a way to stay together. And maybe that has been the true testimony. We stayed together in spite of this happening.
October saw two massive hurricanes slam the Caribbean and the Gulf Coast of Texas and Louisiana. Many people sent donations or relief supplies. Still others, like federal and military personnel, went where help was needed most. Zach Renstrom of Wynn Army Community Hospital has the story of one healthcare provider who made a difference.
It's hard to describe because the Virgin Islands themselves it's obviously a beautiful place. It's in the Caribbean. It looked as if there had been a forest fire, but there was no fire. So all the trees were completely stripped of their leaves. There was no green. It was completely brown. Most houses were completely destroyed. There were power poles everywhere, kind of snapped in half all over roads. The residents were 3 weeks in of having no electricity and had just recently started getting supplies like water, food, shelter, those types of things. So they were really struggling with that. It was pretty unreal to be there ourselves and not have those amenities, but obviously much more impactful for the residents who had been going weeks without those kind of creature comforts. I was deployed as part of the federal government's response under the Department of Health and Human Services to provide mental health services to the residents of the United States Virgin Islands who were affected by hurricanes Irma and Maria. We met with a lot of agency leadership, so the head of FEMA, the head of American Red Cross, nonprofit organizations that were there, different federal government assets. There was a lot of military folks there. So we met with the leadership there and figured out what did they need from a mental health perspective. So we really tasked with two different things. One was providing training to those first responders on how to interact with residents from a mental health perspective. So training them on psychological first aid, how do you discuss with those residents how they're doing, how their mental health has been, how they've been coping. And so training those first responders on how to interact with residents, being mindful of the impact the hurricanes had on their mental health. And then our second mission was to interact directly with the residents and provide psychological first aid. So talking with them, recommending different ways to cope, encouraging them to seek out social support, so working directly with the residents. I was amazed about how resilient the population was. For the most part, people were doing really well, better than I would have anticipated if I had lost my house and electricity and power and all of those things. For the most part, they seemed to have a positive outlook. I think it was pretty inspiring, if nothing else, particularly working directly with the residents. Seeing how resilient people are following disasters was really neat to see, and to see it firsthand, to be able to respond during times of crisis when people are really struggling with huge disasters. I think it's important that we, as soldiers, service members, officers, step up and answer the call.
That's the Regional Health Report for November. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Flipboard, Pinterest, and YouTube. We're also on the Army Medicine channel of the Defense TV app. Thanks for joining us.